So my topic I used in my CILE paper was gastric cancer in South Africa, um, and with particular implications in the public health of in the public health infrastructure of sub-Saharan Africa. My name is Edidiong, and one reason why I picked this topic is because there's been an increase in non-communicable diseases such as cancer globally. But in Africa, the focus of most public health interventions are on infectious diseases. So I wanted to just examine one, take a particular cancer um, that I'm interested in looking into and seeing if there's the incidence of such cancer in a particular country in Africa, and see if they can be any learning points and applications that could be used in other countries in Africa. So gastric cancer is the fifth most diagnosed cancer globally and fourth most common cause of death, but its incidence is declining due to better food preservation, treatment of an infectious agent that causes it, Helicobacter pylori, improved screening and early diagnosis, which is most evident in East Asian countries, which have the highest incidence, but have the lowest mortality due to early improved screening and early diagnosis. And also increased public awareness, which helps um, inform people and lead to behavior modifications in avoiding smoking and alcohol, which are factors that can contribute to the development of gastric cancer. Gastric cancer in sub-Saharan Africa is the 12th most common cancer in the region. It also appears to be declining following global trends, but the exact epidemiology is unknown. And this is because of the lack of comprehensive cancer registries and poor diagnostic infrastructure. And there's a general poor prognosis due to late presentation. I chose to focus a little bit more on gastric cancer in South Africa, and I use South Africa because it has a relatively um, better healthcare public health system, which is evidenced by low infant mortality rates. It also has high human development index, which points to improved infrastructure for public health, and also available relevant research on cancers in general compared to other African countries. For my methods in this paper, I used PubMed and Google Scholar, and I looked at search terms using gastric cancer epidemiology, gastric cancer in sub-Saharan Africa, gastric cancer in South Africa, risk factors of gastric cancer, and screening of gastric cancer in South Africa. I used only English-based, English written text written in English language and who had available full text. And the time range I searched for was from 2000 to the year 2020 currently. And for articles that I found that were relevant to my topic, I also looked at the reference list to see anything, if there are any articles that I could use to acquire more data concerning the topic of gastric cancer in South Africa. The epidemiology of gastric cancer. In South Africa, the National Cancer Registry is in charge of cancer surveillance. It was established in 1986, but it wasn't until 2011, with the passing of the National Health Regulations Policy, that cancer was made a reportable disease by both public and private laboratories. So before then, it was only voluntary for laboratories to submit cancer data, but after this policy was enacted, cancer was made a very reportable disease, and that improved the gathering of details concerning the incidence uh, and prevalence of gastric cancer. And with the passing of the national health policy, there was also plans to establish population-based registries throughout the country. So based on data from GlobalCan, which is the Global Observation Global Cancer Observatory, which is run by the WHO, the incidence of gastric cancer is 3 out of 100,000, which is relatively low, comparable to rates in the US. This figure is obtained from data from the National Cancer Registry and from neighboring countries. Men are 2 to 3 times more likely to get gastric cancer compared to women in South Africa, and gastric cancer ranks 10th to 13th most incident cancer for the last 10 years, which is an improvement from the 1990s, which it was among the top 10 cancers in the country. New patients are mostly diagnosed at the age of 55 to 75. And of the population groups in South Africa, the colored population group has the highest incidence. And more studies will need to be conducted to see if there's any association with behavior or ethnic genetic predisposition for the development of gastric cancer in this group. The mortality of gastric cancer, according to the Global Observatory of Cancer, is also around 3, which mirrors the incidence. And the reason why is because of the late presentation of patients for treatment when they get gastric cancer. And there's also a poor availability and access to screening services, a lack of public awareness of the dangers of gastric cancer and how to prevent it. And there's also been a preference for traditional healers for treatment of unknown things rather than turning to modern medicine. So there are 2 types of gastric cancers, main gastric cancer subtypes, intestinal subtype and diffuse subtype. Intestinal subtype is by far the most common one, especially in Africa. Um, the diffuse subtype has more of a genetic link, but it's much rarer, and it's mostly found in younger patients. Of the risk factors of gastric cancer, the most important one is the infectious agent Helicobacter pylori. H. pylori has a high incidence in Africa in general and in South Africa. In a township in South Africa, it's reported that children by the age of 12 begin to have have 100% prevalence of Helicobacter pylori. So it's really quite young in the population in South Africa. But despite this, there's not been an increase in the incidence of gastric cancer. This has been termed African enigma, where there's a high incidence of Helicobacter H. pylori infection, but there's a low incidence of gastric cancer. Screening, upper endoscopy is the gold standard for screening. South Africa does not have a screening program due to its low prevalence of gastric cancer. There's also been a shortage of trained endoscopists and gastroenterologists and inadequate diagnostic equipment. So this may also predispose to like misdiagnosis or inadequate diagnosis and screening of the population of South Africa to check for gastric cancer. So there are not enough people and equipment to screen for gastric cancer. So in general, in the conclusion of my paper is that the rate of gastric cancer appears to be declining in South Africa, but there needs to be an improvement in the cancer surveillance system. There's not enough population-based registries which are very necessary to quantify the epidemiology of cancer. And with the accurate quantification of the epidemiology, you'll be able to plan better screening protocols if necessary. There is a need for more endoscopy training in the country. The new screening technologies is required, and, and also there's the need to reduce brain drain, which is the loss of trained medical professionals who emigrate from South Africa looking for better opportunities elsewhere. So my recommendations are that all of these things are improved, we'll be able to accurately quantify what the effect of gastric cancer in the public health system in African countries, not just in South Africa, because this is a problem that's not only unique to South Africa, but it's found in most African countries. Improve surveillance uh, by using population-based registries, improve diagnosis and screening by training more endoscopists, and also providing the right screening equipment, and reduce the loss of trained of medical professionals who can better screen and raise awareness of a health need such as gastric cancer in the region. So thank you for listening, and it was great presenting this to you.